Hi everyone. Thank you so much for joining me in today's lecture. So our topic is fetal presentation and fetal situs. And this topic, today's lecture, will help you clinically plus especially in ARDMS OB tricky MCQs related to this topic. And I wanted all of you actively participate in today's discussion. Then you will understand this topic much better. So first one, fetal lie and presentation. We will quickly go through this and then we mainly focus on fetal situs. So our main focus will be on the images. Okay, now there are two main lies, longitudinal and transverse. What is the meaning of longitudinal lie? Anyone? Longitudinal mean fetus spine is just parallel to the maternal spine. Exactly. Fetus spine is just parallel to the maternal spine. And transverse? Fetal spine is just perpendicular to the maternal.
Perpendicular to mother spine.
Yes, exactly. Okay. Now longitudinal lie has further two presentations. It could be cephalic and breech. And what is the difference between cephalic and breech? Anyone?
Cephalic, the head toward the internal fossa, while breech, the head toward the maternal abdomen.
Exactly. Cephalic mean head is down. As you can see here, cephalic head down. Breech, head is upward toward the abdomen and presenting part could be buttocks or feet. There are further subtypes in the breech presentation as well on the basis of presenting part. Transverse lie. So now there could be two chances. Head could be either toward the left side, as you can see here. Our head could be toward the right side. Okay, now here we can see longitudinal view or transverse view. Anyone? Longitudinal, exactly. In the longitudinal or the sagittal view, this is the marker site and it represents the superior portion. So this one represents superior section and this one represents inferior section. What we can see here, head is near the inferior portion. So head is near the cervix. So this is longitudinal view. Probe is just in the sagittal orientation. And we can see head is near the cervix. Head is inferior. So it will be cephalic fetus, breech fetus. Which one? Cephalic presentation. Exactly. Because head is down. Head is near the cervix. Here again we can see when our probe is in the sagittal orientation and head is near the cervix, then it is actually cephalic. Yes.
Cephalic presentation.
Yes, cephalic presentation. Okay. Now here we can see head toward the cervix And also spine could be in the anterior or posterior. So here we can see cephalic spine anterior. Here we can see cephalic spine posterior fetus. So, okay, if we get this type of image in the exam and they tell you that probe is placed in the sagittal orientation, so what is the presentation of the fetus? You can easily answer it is cephalic because head is toward the cervix, and if the head is here toward the fundus, then it will be breech. Now in this type of questions, probe position is very important. Okay, now what if in the question it is mentioned, like they give you this type of picture and they say probe is transversely placed. Probe is transverse and you get this type of picture. Then what will be the presentation of the fetus? Anyone?
Transverse.
Yes, transverse and head toward right or left?
Or the left.
Yes, because if it is obtained through probe in the transverse orientation, this is marker side, it's gonna be right and opposite will be left. So this is then transverse, head toward maternal left, and if the head is toward the right side, then it is gonna be head toward maternal right side. But usually they give you this type of cross section and then they ask like only this type of image, transverse section of fetal abdomen, and they only tell you about proposition and then ask which presentation is this. So this one is more common. Okay, now here we can see transverse section of the fetal abdomen. Here we can see this echogenic spine. Here we can see stomach bubble, which is anechoic. Now, what we have to do to solve this type of questions is always match spine with the stomach
And stomach.
in the shortest possible route. You have to use shortest possible route. So now we are gonna match them from the spine to the stomach. Okay. So is this direction is clockwise or
It's clockwise. Clockwise.
yes, it is clockwise. So whenever we get this type of picture and then we match spine and stomach and it is clockwise, so then we have two possibilities. If the probe is longitudinal and we get this type of picture, then it's most likely which presentation? Any one of you can give me answer?
Transverse. Yes, transverse.
Okay. Probe is longitudinal and we get this type of picture. It is transverse. Head toward right or left? Any guess?
Head towards right.
Head toward the right. Okay. So how we can remember this? Whenever it's clockwise, there are only two possibilities. If our probe is longitudinal, we know it's transverse. And transverse head toward maternal right. And if our probe is placed transverse, then we know it is longitudinal lie. There are two chances, cephalic or breech. When it is clockwise, then it is...
But ma'am, in situs inversus, it is opposite, na?
Okay, we are slowly going to first discuss about normal. And yes, like in situs inversus, it is actually opposite. So first, we will discuss that what is normal, and in situs inversus, obviously it is opposite. And I know this topic is tricky. So don't worry, we are going to repeat this again and again. And when the lecture will finish, then you all will understand it. So in exam point of view, they give you this type of pictures. Okay, what is the purpose? The purpose is they want you to test. You know about how to apply this situs, normal situs identification and situs inversus in the clinical practice. Because if you know that if it is a cephalic fetus, spine and stomach, they will match in a clockwise direction. You know that it is a normal presentation. Because during scanning, you first determine presentation and lie. You already know this is a cephalic fetus. And then you get the transverse section of the fetal abdomen, and you see that spine and the stomach, they match clockwise, and this was expected relationship or position. Then you know, okay, it's normal. And if it is opposite, the stomach is present here, not here. And you know it is a cephalic presentation. And now spine and stomach, when we match them in the shortest route, now this relationship is anti-clockwise. So you know that it is not normal. Now it is abnormal. Usually in exam, they give you this type of cross section, but you should also know about fetal chest and heart orientation in relationship to the spine. So normally we know stomach is toward the left and heart is also toward the left. So they should be in the same direction. Here we can see stomach toward the left and also heart toward the same side, toward the left. From the spine, you can imagine, like you can draw imaginary line just perpendicular to the opposite side. So we know spine is posterior, and draw imaginary line just opposite to it. It is anterior, and heart apex, we know it normally it should be pointed toward the left, and the same side where we see the stomach. Anterior, posterior, and stomach is toward this side, it is left. So heart should also point toward this side, and heart, like we don't see stomach and heart in a single view. First, we get this type of cross section where we only see the stomach. Then we can split the screen in two. At one side, we see the abdomen, transverse section, we see the stomach bubble. In the second one, we just sweep and we see the heart. So heart axis should point toward the same direction where we see the stomach. So stomach and heart should match. Okay, now in cephalic fetus, from the spine to the stomach, we see a clockwise relationship. So heart should also follow the similar pattern. Here we can see the spine and here we can see the axis of the heart. Now we are gonna match them. So it is clockwise. If the heart apex is toward the opposite side, toward here. And now we are gonna match them. So it is anti-clockwise. So for a cephalic fetus and for transverse head right, normal relationship is clockwise like this. And this one is abnormal for them. We can see another picture of a cephalic fetus, and now when we place the probe longitudinally and we get this type of long axis view and head is toward the inferior, it is cephalic fetus. To get the transverse sections, for example, the transverse section of the head. So here we can see probe is placed also transversely. Here we can see the face view. Here we can see chest cross section, transverse section. So how we place our probe? It is transverse. Then we get this type of cross section. Also for the abdomen, we place our probe transverse. Here we can see another level image of the fetal abdomen. Okay. This is again cephalic fetus images, but now this is with cephalic spine anterior, but all of the principles would remain same. So you can see in the longitudinal view, head is toward the cervix, and in the transverse view, when we match the spine with the stomach, so is it clockwise or anti-clockwise?
Clockwise.
Clockwise. So the main relationship is same here. Here we can see the heart, the transverse view of the chest, and we can see the fetal heart. So we can see fetal heart axis here pointing toward the same side as we saw the stomach. And when we match spine with the apex of the heart, their relationship is again clockwise. And how we place our probe? In the transverse orientation. This is another picture. We can see in the longitudinal view, head toward the cervix. In the transverse view, we can see spine and the heart. Relationship is clockwise and probe is transverse. And here we can see spine and stomach relationship is clockwise. Now coming to the breech fetus. Okay, how many different types in the breech presentation? Any one of you can please tell me their difference? Frank breech, complete breech, footling breech. What is the difference? Anyone? Okay, in frank breech, buttocks are presenting part. So buttocks are lower in the pelvis, close to the cervix. And we can see foot seen near fetal head or upper body, as you can see here. And fetus is usually in the cross-legged position. Now complete breech. So in complete breech presentation, here we can see again fetus is cross-legged, but now the foot are not near the head or upper body, and presenting parts could be buttocks, and here knees and hips are just flexed. And now in this image we can see buttocks are presenting part, hips are flexed, but knees are extended. Knees are extended here, but here knees are flexed and hips are also flexed, and fetus just sits cross-legged and buttocks are presenting part. So that is the difference between complete breech and the frank breech. Frank breech, in this position knees are extended and the head and the fetal feet seen near the head are the upper body. Footling, as a name tells us, one or both feet present first, as you can see here. Now presenting portion is the foot. Now in the longitudinal view, you will see head toward the superior side, toward the fundus. Now here we can see the transverse section of the fetal heart. To get this type of longitudinal view, we place our probe longitudinal and head is toward the superior. Now to get the transverse section of the chest and the fetal abdomen, we have to place our probe again in the transverse orientation. But now the relationship between the spine and the stomach and the heart is opposite. It's now anti-clockwise, and we can see here in all of the images. So spine and the heart axis, normal relationship is anti-clockwise. As you can see here, it is anti-clockwise. Okay, now here we can see transverse section of the abdomen. So spine and the stomach, and their relationship is anti-clockwise. Here we can see some more images. Okay. Now let's apply this rule in this image. Spine, stomach, relationship. Is this clockwise or anti-clockwise? Anyone?
Anti-clockwise.
Anti-clockwise. Yes, and this is normal relationship between them. Here we can see image of frank breech. We can see foot near the head here and knees are extended. Foot link. So presenting part will be the foot here. Cord presentation, umbilical cord will be the presenting part. Okay, now coming to the transverse. Now to get the longitudinal view, like we see the longitudinal view in the cephalic or breech, to get that type of images, here the probe will be transverse. And to get the transverse section of the chest and the abdomen, now we have to place the probe like this, longitudinally. So probe will be longitudinal to get the transverse sections of the chest and the abdomen. and the relationship. So here we can see there is spine, stomach. Relationship is clockwise.
Clockwise.
Okay, any one of you can please tell me that is this transverse head right or left? Any guess?
Head, head left.
Okay, clockwise, transverse head right. Anti-clockwise, transverse head left. So here clockwise, so presentation is transverse head toward maternal right side, as we can also see here in this image. And when this is opposite, the stomach is present here. So this relationship, this anti-clockwise, is normal for transverse head toward maternal left. And same rule for the relationship between the spine and the heart. So when we match spine and the heart apex, you can see clockwise, then it tells us the lie is transverse head toward maternal right side. Okay, now we are going to discuss the same topic, but now in a much more simplified way. So whenever probe orientation is transverse, and in the exam they give you this type of cross section. Transverse mean lie would be longitudinal or transverse? Anyone?
Longitudinal.
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 Yes. Whenever probe is transverse, lie will be longitudinal. So fetus is either cephalic or breech, and to solve this type of questions, they will definitely tell you about probe position. So when they say in exam, the probe is placed transverse. What about fetal presentation? So you know it's either cephalic or breech. Then you see relationships of spine and the stomach. So spine and stomach relationship here in this image is now clockwise or anti-clockwise?
Anti-clockwise.
Anti-clockwise. Okay. So now specifically in this transverse section, what does it tell? It's cephalic or breech?
Breech.
Breech. Yes. For the cephalic, it is clockwise. C for cephalic and C for clockwise. Okay. And anti-clockwise mean it is breech. Whenever the probe is placed longitudinal, as you can see here, and you get this transverse section, it's either be transverse head maternal left or right. Now here we can see their relationship is clockwise. So it's head toward maternal right or left?
Right. Right.
Right, exactly.
Right. Exactly.
Okay. Now here we can see probe is transverse. So in the exam they will tell you probe is transverse. So fetus is either cephalic or breech. Now the relationship here,
Cephalic.
Okay, there was distortion. That's why I muted everyone's mic. So, spine, stomach, relationship clockwise. So, it's gonna be cephalic or breech?
Cephalic.
Yes, cephalic fetus. Whenever probe is transverse, so fetus is either cephalic or breech. Now here, spine and stomach. So their relationship is anti-clockwise. So is it cephalic or breech?
Breech.
Exactly, breech. Okay, now probe is longitudinal. So fetus is either head, maternal left or right. Okay, now in this image, what do you see? Their relationship is clockwise or anti-clockwise?
Clockwise.
Okay, it's clockwise. So head toward maternal right or left?
Right.
Exactly. So longitudinal probe, fetus is either head, maternal left or right. So here we can see clockwise relationship means head toward maternal right. And here we can see anti-clockwise relationship. So it means transverse head toward maternal left. Okay. So now there's quiz. Tasween, can you give me answer? If probe is longitudinal and you see this type of cross section, then what about fetal presentation?
This is a longitudinal anti-clockwise.
Head right.
Head was right. Yes, transverse position.
Breech. Transverse. Yes.
Okay. Anyone else?
Transverse, head towards the right.
Yes. So because probe is placed longitudinal, it means it is a transverse fetus and relationship of the spine and the stomach here is clockwise. So head toward maternal right. Okay. Abdisa, can you please tell me the fetal presentation in this image? Anyone else? Because I think Abdisa left the meeting. Dr. KP Singh.
Clockwise, cephalic. Longitudinal line. Cephalic, clockwise.
Yes. Because probe is transverse. Relationship here we can see is the clockwise. So it's gonna be cephalic. Okay, what about this presentation?
Clockwise. Yeah, cephalic.
Clockwise. Cephalic.
Okay. Probe is transverse. So it's a longitudinal line, either cephalic or breech. And now when we compare it from the spine, so relationship here is the clockwise. So it means it is a cephalic fetus. Okay, what about this?
Also cephalic.
Anti-clockwise. Yeah. Clockwise, cephalic.
Clockwise. Cephalic.
And clockwise.
Probe is longitudinally placed here. probe is longitudinal and you get this type of picture. So are you sure that it's cephalic?
Yeah, it's not.
It's not.
Transverse.
Yes. It's transverse because the probe is longitudinal. So probe position is very important. When probe is transverse and you get this type of picture, it's cephalic. It's cephalic, but when probe is longitudinal and you get this type of picture, clockwise relationship, head toward maternal right.
Right.
Please, does that mean if the probe is transverse, that is when we have cephalic, and then when the probe is longitudinal, that is when we have transverse?
Yes. That is the point we discussed in the very start, that to differentiate the cephalic and transverse head toward maternal right, what we should know is the probe position, because their transverse section will look the same. Clockwise relationship between the spine and the stomach, and the spine and the heart. So what's the difference? Probe position. In the cephalic, probe is transverse and head toward maternal right, probe is longitudinal. Okay, what about this one?
Cephalic. Longitudinal. Clockwise.
Transverse.
Transverse.
Right. Towards maternal. Right.
Probe is longitudinal. So whenever probe is longitudinal, then it's transverse.
Yes.
And because here it's a clockwise relationship, so head toward maternal right side.
Yes.
Okay. What about this one?
Cephalic.
Yes, cephalic. Transverse probe and their relationship is clockwise. It means it is a cephalic fetus. Okay. Now we discussed about what is normal and also how to identify the right presentation in the exam. Now I am giving you some scenarios. So if during scanning you definitely know exact presentation, if it is a breech presentation, you are 100% sure during scanning that it is a breech fetus. But when you get transverse section of the fetal chest, okay, this one, probe is transverse and you know that it is a breech presentation, but you get this type of relationship with the spine and the heart apex. So what do you think? Is it Situs solitus, or is there something wrong?
Yeah, something's wrong.
How
Extracardial.
how we can identify it?
In a breech anti-clockwise. And this is clockwise.
Yes, breech anti-clockwise. So apex should be somewhere there. But we can see clockwise. It means now there is something wrong. So either if only heart is at the wrong location, if only heart is toward the opposite side, then it is dextrocardia. If only heart position is changed. But if the heart is toward the opposite side, and also when we see the stomach, so heart apex toward this side and a breech fetus, and also spine and stomach relationship is clockwise. Then it means situs inversus totalis, because heart
Yes.
is toward opposite, stomach is toward the opposite side. It means it is situs inversus. But if the stomach is here for the breech fetus, normal relationship with the spine. Only heart is toward the opposite side. It means it is case of dextrocardia. So, first you determine the presentation, then you see the relationship of the spine and the stomach, also of the spine plus heart, and you should also see aorta and IVC location. So here you can see aorta just in front of the spine and toward the left, and IVC is usually toward the right side. Also see aorta and IVC, their location, and also see the relationship of the portal sinus, because it always it goes away from the stomach. So match all of these things.